primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
And welcome to today's update, where we'll be discussing about COVID-19, what we are doing as a sector in collaboration with other stakeholders, where we are at this point in time, the people on quarantine, because we are in those various areas of operation. And then, and it's also it's a requirement for countries to provide updates in a way of sharing information to the general public during public health emergencies or pandemics. And that is why the ministry is working very hard with stakeholders like you, colleagues from the media, to brief the public as to what we are doing. And that's why today we're also here, the 21st of April 2020, which will give you a situation report with regards to COVID-19. And this is going to be done by the Honorable Minister of Health, Honorable Ahmed Lamin Samare, but it's going to be delivered on his behalf by Dr. Mustafa Bitte, the Acting Director of Health Services. So before he comes in, I just want to take the opportunity on behalf of the ministry to thank you all for coming and for being with us, because we are together in this. We cannot pass the information to the public without the media. So your active participation before COVID-19, during the response period, and up to now is really very much appreciated by the ministry. So we will thank you, and your institutions for allowing you to come and cover these events, which are very useful events for the general public. On that note, I now invite Dr. Bitte to come and give a statement on behalf of the Honorable Minister.
Good evening, once again, ladies and gentlemen. This is the 31st National Situational Report since the confirmation of the first case of the novel coronavirus disease in the Gambia on the 17th of March 2020. The following are the updates. 29 new laboratory results have been received, and all of them are negative for COVID-19. 6 new persons are taken into quarantine, and all of them are Gambians returning from Senegal via different ports of entrance. 3 persons discharged from quarantine upon completion of their mandatory stay, and they tested negative for COVID-19 before discharge. A total of 68 contacts of newly confirmed cases have been traced. Currently, the country has 93 persons under quarantine, 7 active cases, and no probable case. Globally, since 31st of December 2019 and as of 20th April 2020, a total of 2,478,406 cases of COVID-19 have been reported. Of these, 164,930 deaths were registered, and 645,723 recovered from the disease. Senegal recorded 377 confirmed cases, 235 recoveries, and 5 deaths. Summary: a total of 361 tests were conducted and 10 are positive. 264 people completed quarantine, 441 contacts traced, and 310 people completed follow-ups. There have been daily coordination meetings ongoing at both the strategic and technical levels. On logistics and safety, the National COVID Response received 1 consignment package of 2,000 medical N95 face masks, 10,000 ordinary face masks, 2,000 medical protective clothing, 2,000 face shields, 1,000 disposable medical gloves, 10,000 disposable shoe covers, and 500 sets of forehead thermometers. The following items were also received as donation from the Jack Ma and Alibaba Foundation: 10 ventilation machines, 36 thermometer guns, 9,500 medical gloves, 3,800 protective face shields, 3,790 protective clothing, and 18,900 nucleic acid extraction kits for the lab. So, donated items also received from the Gambia Association of Public Health Officers, consisting of hand sanitizers, bleach, detergents, and amongst others. So, distribution of donated items to the regional health directorates are ongoing. Regarding our next steps, the Minister of Health will embark on the following: we provide security in the homes of families under quarantine and/or at the treatment centers. Introduce a car lock system for the COVID-19 response fleet. Contact listing and thorough tracing of contacts of newly confirmed cases. Strengthen community surveillance in all regions, especially at undesignated border areas. Continue with daily follow-ups of low-risk contacts and those discharged from quarantine. Encourage public reporting and self-reporting of suspected cases through the toll-free line 1025. We would like to thank all our partners in the fight against COVID-19. At this point, I would like to register our profound gratitude to Ambassador of the People's Republic of China to the Gambia, the government and people of China for their support to the government of the Gambia, particularly the Minister of Health. We would also want to thank Mr. Kante our private sector partner, for providing the electronic billboards in the Greater Banjul area for the dissemination of COVID-19 messages. We would like to extend our sincere thanks to all frontline health workers, particularly those at the points of entry, quarantine centers, surveillance units, laboratory, rapid response, case management, risk communication and community engagement, logistics and security, and contact tracing for their sacrifice and dedication to duty. We would therefore appeal to the area council leaderships, district chiefs, village heads, and ward councillors to support the implementation of the state of public emergency regulations, as well as observe social distancing in their various jurisdictions. We would like to renew our call for all private and commercial vehicle owners, as well as motorcyclists, to adhere to the regulations in their amended forms. Together, we can fight against COVID-19 in the Gambia. Thank you for your kind attention.
Thank you, Dr. Bide. I now invite Sankano to facilitate the question and answer session. Mr. Sankano.
Thank you very much, Director of Health Promotion and Education, Mr. Modunja. Thank you very much, Dr. Mustafa Bite, Acting Director of Health Services. Ladies and gentlemen of the Media Corps, on behalf of the National Health Emergency Committee, I open the floor for questions. Your media organization and your name. Yes, ma'am.
Good afternoon. I am Aisha Bijala from Gambian Talents TV. A lot of people are concerned that you normally announce positive cases on weekends, most especially Sundays. So what is the secret or the reason behind that? Or is it that you only have exclusive testing on weekends?
Thank you very much. I'll ask Dr. answer. I think it's just a matter of coincidence. Doctor? About Sunday announcement.
Thank you very much. So the question is, I think that's purely coincidental. There is no, I think if you analyze into it, it is not, all the cases were not on Sundays. But I think the last two have been on Sundays, and it's purely coincidental. It's not like by design or anything. Thank you.
Any additional questions? Yeah?
We've seen so far, especially the ministry or the Gambia government in particular, so far the development that we've seen or that is being portrayed in terms of infrastructure development, among others, are mainly coming from the private people, ordinary citizens or institutions. So, last week the Minister of Finance have said that over 140-something million have been spent, which many Gambians have somehow criticized because the government, in particular, they didn't see anything of any meaningful area that they have put funds in, apart from the isolation centers of hotels that we rented. Is there any other area, or are there equipment that the Gambia government have so far bought and they are on their way coming? I'm talking of the Ministry of Health, because I'm not talking of the whole 100 and something thousand. But the ministry itself, so far the money that you have been requested from finance, is there medical equipment part of that package? Because what we've seen are all donations coming from China and elsewhere that you are currently having at stock.
Thank you very much. I'd like to invite Dr. Bite and Mr. Njai to elaborate on that.
Basically, Kante, thank you very much for that excellent question. I think the Honorable Minister of Finance and Economic Affairs really made it very clear here with regards to the expenditures that have already been done. And prior to the 500 million, and the ministry already had in its coffers around about 12 million. And then those monies have been used to facilitate the availability of hotels for quarantine centers across the country, not only here, and then also the monies also have been used to build capacity, and then as you know, capacity strengthening is also very key in response. So that monies have been also used on other operations, like for example, provision of certain essential equipment. And I'm sure that if we talk about equipment, the ministry was in the process of procuring, and also as you know that now that flights are not available and other things, but at least there are plans to procure certain equipment. And then it's not only about trying to what we are seeing currently. We know that the donations are there, people are donating, organizations are donating, countries are donating, but the ministry is also spending money even to refurbish isolation centers in various health facilities, providing equipment, and also to building capacity of health workers. So as you know, Minister made it very clear here the last time that equipment for health facilities or health equipment or materials are very, very expensive, and some of them will cost nothing less than millions of dollars. So I think Minister made it very clear to you yesterday at the airport that health equipments are very, very expensive. So if you look at the amount of money that has been provided and you take out the expenditures for equipment, you end up not having less amount of money. But what you are asking, we will keep you updated. We will tell you what we have been doing, and then we will also come and present to you how the monies have been spent and where they have been spent. And I think prior to certain donations, ministry also have been spending monies on those, and then we will give you the financial expenditures on those ones as to tell you where we have spent those monies, inshallah. And I think Dr. Bide will be able to add on the equipment. Dr. Bide, you have anything to add on to that?
Thank you, Mr. Njai. So I think first of all, we'll also, like Mr. Njai said, encourage private facilities and private individuals to continue the donations and all what they are doing, because we are in this together as a country. It's not only the government, but like you said, and Mr. Njai has already alluded to, there's a lot of resources is being put on medical equipment, and the procurement part of it has already been concluded, and we just in the last processes, like he said, to try to get flights and all. So once we get them, we'll come. So in due course, the breakdowns of what we have bought and where it was bought from and what are the prices, I'm sure will all be public knowledge.
I'm still not satisfied. In a sense, I want it to be more specific. Yes, for instance, we bought 1 million face masks per se. Things of such. I want it to be that than we are assuming or we are planning to buy.
Okay. Kante will make it very clear to you now that procurement process have started. In government procurement procedures, you have to follow all the procedures. GPPA is there, you have to go through the procedures, and then the process is almost completed. Now that arrangements are arrangements are on the way now to get the flights, so we're able to get this material in country. So if they come, then we will tender the list to you to say this is what we bought, and these are the materials, as Dr. Bitera mentioned. We bought this amount of materials, they come from this country. This is exactly what we will tell you. So there's nothing to hide, actually, Mr. Kante.
140-something million.
Yep.
How much did the Ministry of Health, request from that said sum that the minister said here? Apart from the isolation centers that you pay, which other areas did you spend money? Okay. Is it that you bought equipment which are on the way coming? If yes, what are they? In short.
Okay. Let me facilitate, make that thing clear to you. If you
there is criticisms that the 140-something million, where did the government spend that?
Okay.
They cannot see.
Okay.
If you bought vehicles, what did you spend it on? Apart from, because the minister said, even the school classes that are going online on TV are all part of this package. And I'm sure maybe other areas, other ministries also will all be starting to benefit.
Sure.
Health particular, how much did you receive from that sum?
I think we made it very clear, Lamin Kante, we made it very clear that we will give you the financial expenditures of what we have done. Right now, you talk about procurement. The process is already ongoing and it's not completed. You don't even pay money when things are not procured. Now you just send your items, they will deliver them, and then you do your process. So now we cannot tell you exactly how much we are paying for the procurement for the procurement of those equipment. That is there. And you talk about the vehicles. In fact, I forgot about the vehicles. I'm just coming. I'm coming.
How much did you get from that place?
We will give you the financial reports. Yeah. Those things are not available with us now. We will give you the financial report and we will give it to you as soon as we get, because right now, as I tell you, we just recently got a project manager to coordinate this interventions on COVID-19. We will give you details of what has been spent. I think you should be satisfied with that statement by the minister, who said it very clear that information will be shared with you accordingly. So let's just not be in a haste. Now, I mean, like, not much has been done, for example, like going through, massive expenditure. We've not got, we are still in the process, and when we come back, by next week, I'm sure when we come back here again, we'll get some information to share with you. We'll be able to tell you this is what the Minister of Health got from Minister of Finance, and this is what we have spent on A, B, and C. That will happen. Just take it from us, yeah. Just take it from us. We'll do gradually. We will give you the answers. Thank you.
I have one final question before we close for the day. Yeah. Thank you. I invite Director Moringa.
Basically about the allowance, we're not talking about allowance here. We're talking about an incentive or honorarium for the health workers. This was discussed at length. We know that the first list has been processed, has been approved for certain category of people in the various areas, like, for example, case management, psychosocial support, and then also laboratory and surveillance. Now that the next batch of payment will be, the next batch is payment, I think they had a meeting today, and then if approval is done, payment also process will also start from tomorrow or next tomorrow, so that they can also get to that people. And then for the regions, we want to make it very clear, for the regional health directorates, what we've agreed technically is that the regional health directorate will now sit, they'll be represented by the regional health director of West Coast Region 1, that's Kanifing, to sit with one of the team members here to review the composition of the teams that they have provided. We all know that when we talk about emergencies, there are key people that are in the front line. We all know that not everybody will be participating directly. Some are participating directly, some are participating indirectly. And then we came up with a stratification, payment stratification, looking at the risk involved, looking at the level of risk that those people who are involved in the process. So all those things are, we are on the table to be discussed, but no one will be left, as long as we are part of this process, no one, because the minister has been emphasizing that the frontliners must be considered. This has been his words throughout, and we're going to make sure, as technicians, we make sure that those things are implemented accordingly. But no one will be left behind. Only those who are maybe left behind are the people who are with us and they are not participating and they are not doing anything, and they have nothing to do with emergencies, like this pandemic. It can happen in any society. You see people who are, people are doing certain work and they are not part of it, and you don't expect to have something like somebody who is not having, who is not sleeping for 12 hours, for example, and then you are sitting in the office, you are not doing anything. So those things, all those things, we came up with what we call, payment, the risk stratification, and in that risk stratification, anyone who falls into that category, any of the category, either high risk or low risk, or at another level, maybe a medium level, so we can look at it and say, okay, so and so can be paid this amount of money. But those things are technically, we are discussing that. But when you talk about at this level here, we reviewed the list with the minister. I was there last week, Thursday. We were with the minister up to 2 a.m. All the technical people were there. All the technical leads were there just to review the list. And what we have realized, that in some of the components, certain names appeared more than 3 or 4 times. That has also increased the amount of money that was supposed to be paid. And then when we reviewed, we projected it, we were able to find, clean the list. And also along the way also, identify those who have been working in the front line. So that was also done. That is why the payment also has started. And we've also done that also for the next batch that is also coming. And for the regions, the recommendation was let's allow the regions to go back and they review their list, because the list they provided to us was more or less a shopping list. So we have to be very frank to each other when we are working. So some of because the list that has been provided, I mean, if you look at it sensibly, you can be able to say that, I mean, certain people are not really part of the process. Like, for example, I mean, you want to put an accountant, you know, who is working at the regional level, for example, and you call that person a front line. I'm just giving an example. So perhaps they don't have direct contact with the client, for example. So this is what we are talking about. These are some of the things we are trying to look at to review, I mean, who really matters in this case. And that has to take a process, and that's why we have given the baton back to the regional health directors for them to review, because they know their staff. We don't want to sit at central level and decide for the regional health teams. We want the regional health director now to take up the responsibility. I mean, imagine the list. This was given to certain regions, and for them to give us information, it took almost about 1 or 2 months. We cannot get the information. But now that's why we have to take it back to them again to give us what actually we need at that point in time. So that's why we are waiting for them. When they finalize their list, we still go back again and review. Because as I told you last time, we were with the minister up to 2 a.m. And then we will do the same thing again to make sure that every regional health team will scrutinize the information they provide to us, and we determine who should be given this allowance. So that's ongoing. So no one will be left behind as long as you are in this process. Thank you.
Thank you. I think Mr. Njai has given all the details. No one is going to be left behind. So we are going to have a system where, because this is just a token from the government, from the Gambian people who appreciated the health workers. It's just a gesture. So when we went to the National Assembly, it was reiterated and emphasized that they thought that the frontliners, the health workers, because of all the risks they are exposed to, is a gesture, a token of appreciation from the people of the country to the health workers. So it has to be very clear that the health workers are not in this for the money. Because what is being given is not a huge amount. So they are doing this because they want to serve the country, but something has come in and they just appreciate it. But they are not saying that they are going to, if they don't have this money, this is not going to happen. The nurses have come to us to tell us even, that, if you are not paying, they are not that much interested in the money. What they are more interested in is the protection, the PPEs and all that. So we rest assured that the health workers are not in this just for the money. But Mr. Njai has mentioned something very important. So first, there will be all of them, all the health workers, just like what is happening in the sub-region, will have this token. But initially we will start with ones we consider directly like frontliners. And those ones will be given these allowances, and that's what we've started. Then after that, we've already agreed that the token will be given to all health workers. If you look at what is happening in the sub-region, in Ghana, other places, they've all done the same, just to say thank you to their health workers. Other countries are doing it differently. So this is just a token, and there's not so much emphasis on it. Thank you.
Thank you very much. Yeah, Doctor, I think your question is answered. Give chance to the order, or we'll do it tomorrow. It's closed. And
No, you cannot close it.
no, okay, go ahead.
You don't ask. Sometimes you have to wait. When it comes to quarantine centers across the country, we know of the sanitarium. How's it called? You know the treatment center, sanitarium, which is said to be renovated by GCCI. GCCI currently constructing a tent isolation center. You've seen today TAP trying to intervene to renovate Demban Clinic in Kota. Every day at the press conference, you normally used to say that UCK centers in other parts of the country. Can you be more specific? Those centers, I mean by name, did you install new temporary infrastructure, or did you rent places? And what are the capacities of those places that we normally used to hear on a daily basis that such facilities have been created right across the country?
Yeah, what you're talking about, that's an isolation center. We went on a tour. Like all the health centers, they have isolation centers from SAO down, and also on the border post, like Amdallah area. You know, that is where we had these Ebola preparedness centers, which are already structures that were built as part of the preparatory stage for the Ebola. And those structures are there. So they have isolation centers and they have all these processing facilities. So when we are talking about those are isolation centers, you know, quarantine is not being sick. You know, it's a place where they put somebody for some period of time to check whether you have the symptoms or whatever. So it's not the same as being in a hospital ward. Yeah, and then on that note, like, what?
Be specific. Those centers that you are naming,
Yeah.
their capacity.
The capacity, they have different capacities. If you believe it was Lamin,
Yeah.
we work according to facts.
Okay.
We are asking questions right now we don't have. If you want, bear with us, we'll bring you the details. We were there, we visited everything, I will give you the list. ESAU has this capacity. You know, you're asking a question that I don't have the information. I don't want to give wrong information and after you come and say, so just bear with us that, you know, I know there's desire to inform the people, but informing the public accurately is more important, and as a government, and as a responsible government for that matters. We've been to the National Assembly, which is the representative of the people. We gave them all the facts. And if you want to know, you can contact your National Assembly member. And he can contact through the speaker to get the other information if you are in a haste. But be rest assured that we are going to bring you a breakdown of all these centers and give you the capacity. The Director of Health Services is here, Director of Health Promotion and Education, so we will do it. We'll give you the answer. Right now, we cannot give you any answer. Please bear with us. And thank you very much. And like I said, from the beginning, the government encouraged caring and sharing. The private sector and the social sector participation is welcome. The government is doing something, we are all doing something, it's our common fight. And that's why every day in the statement, Dr. Bite emphasizes on together we can defeat COVID-19. And thank you very much for coming. See you tomorrow.
Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing